Well, I think that it's important that we do put a really big focus on mental health issues, and the government has most definitely been trying their best with that. But it's great that the COVID numbers are going down, but the mental health issues statistics appear to be going up. And I think that we may not see the ramifications of that right now, but in the long term and in time to come, I think that we really do have a serious issue here around mental health, and these conversations are really, really important.
Including the obvious reasons for people experiencing high stress, the loss of a job, the pandemic, what other reasons and symptoms are people experiencing that we might need to look out for in ourselves and others?
Well, I think, things like if people are increasing their intake with drugs and alcohol, if they are starting to experience anxiety like they have never had before, if people are starting to feel a low mood that's lasting for quite some time, up to two weeks or more, they need to get that addressed. And it's important to be able to really watch, if you're really, really finding a difference in yourself, particularly around stress, is that you really do reach out for help, because long term, these kind of issues don't always show up early. And so getting early intervention is really, really important. Another thing that, so many people, their sense of self is through the work that they do, being out in the community, being part of a community like a gym or a mother's group. All of those things have been taken away because of lockdowns. And for people who really are able to keep mental health issues at bay because of their investments in those activities, and when that's gone, mental health issues can really start to emerge, and it's a big concern.
Yeah, we hear so much about the importance of connection. Can you talk us through some of the alarming statistics that you've found, Melissa?
Well, there are some alarming statistics, and they're from the University of Sydney. And the prediction is that we will have 20,000 suicides between 20 to 25. Now, of course, these are all forecasts, but 173,000 self-harm hospitalisations, 1.6 emergency visits, people presenting into emergency at hospitals, and 22% increase in lifeline calls. Now, some people are even saying that those statistics could even be higher, because the increase at the moment of suicides is 13.7. So, that is very, very high, and it is a big concern. And that is being forecast by Sydney University.
Well, now more than ever, there is a need of support, as we just saw with those statistics. And there has also been some public concerns why people can't choose a counsellor and psychotherapist over a psychologist. What's the situation here?
Okay, so it's interesting. There's been a lot of public concern about this, and it's been going on for the last 2 weeks. But basically what Beyond Blue have done with the support of the government, $2.5 million has been put into it, a program called New Access, where people who, because now we're having such an influx of mental health issues, the CEO from Beyond Blue has said himself, there is not enough psychiatrists and psychologists to support what's happening at the moment. And so they have a New Access program. It's particularly for people who need it and can't afford it and need their mental health issues, their mental health concerns looked at immediately. So it's coaches. Coaches are actually going in after doing a program to be able to help people. And I have a few concerns about that, as does my industry as well, around the fact that there is so much complexity around mental health issues, and counsellors and psychotherapists are being underutilised. And we have had hours and hours of training, hours of supervision, and also supervision being watched before we are even allowed to approach the public fully. And we are a little concerned around that at the present time.
So why are you, as a counsellor and a psychotherapist, not included in the mental health plan under Medicare, and psychologists and psychiatrists are? I mean, a lot of people don't even know what the difference is. And you've done, 20 years experience?
years experience I've been doing this, and my training's been about 10 to 15 years of ongoing training that we all keep doing, and I find most of my colleagues do that as well. And what the important thing to think about there is, in terms of your question, is, Janie, that we in 2006 the government actually legislated that psychologists could be covered under what's called the mental health program plan through Medicare. And at that time, psychologists had been lobbying for that for decades. And so it was legislated in 2006. And in those times, as counsellors and psychotherapists, we were still kind of growing in terms, we were newer in terms of the mental health industry, and not all of our associations had been formed at that stage. Nowadays, they are incredibly strong, with thousands of people that are part of places like the Australian Counselling Association and the Psychotherapist and Counsellors Federation of Australia. So really, it's a legislation that happened in 2006, and we've been lobbying for quite some time now for psychotherapists and counsellors to be able to be registered within the Medicare program as well. And simply to be able to give people a choice around mental health issues. Not all mental health issues can be treated by a psychologist, although they all do a brilliant job, as we do as well. And so it's really about choice and being able to say, look, I'd rather work with a psychotherapist or a counsellor rather than see a psychologist. Maybe I've seen a psychologist in the past and I want something new. And it's really about choice.
And I believe it's a 3-year minimum degree if you're going to be a counsellor or a psychologist. And finally, finally, Melissa, sorry, I've got to wrap it up soon, but younger people have had to deal with homeschool, which has been, well, a positive to some, but a major stress to others. What have you found to be the main issues?
Well, I work mostly with adults, and what I have found is parents talking about children who actually may have experienced bullying in the past at school and have had the opportunity with the pandemic of being able to be shut down, locked down and work from home. And some now actually, there's a rise in school refusal. So there's been the impact on children as well that we can learn from home, and going back to school for many has been very, very difficult. And that's a big concern, particularly for a child that's never shown symptoms like that before. So there are so many different things we need to highlight around mental health and what's happening in Australia. And I thank you, Janie, for the opportunity to have me come on today.
You've made some really important points. Thank you so much for joining us today. Melissa Ferrari, psychotherapist and counsellor.